Hi, I'm Sophie Godson. I'm a vocational coach. Welcome to your teaching and learning session for manual charting. So hopefully by the end of this session, you can confidently say that you can chart on paper for an adult or a child, as I'm going to go through all the different notations of how to chart for an adult and a child with mixed dentition. Okay, so first of all, I'm going to share my screen. And now you should be able to see a document with two charts on it. And this is what you'll need to print before you attend your simulation. You'll attend the simulation as a group session with one of our knowledge coaches. And on that session, they're going to read out an adult chart and then they're going to read out a child chart with mixed dentition. Mixed dentition means they've got some adult teeth and some deciduous teeth. So the first chart they'll do is the adult chart. Now, before we start, we just need to have a look at the chart and why there's different rows and different boxes on each chart. So the chart consists of 4 quadrants, as it does the same on a computer. So you've got upper right, you've got upper left, and lower right. You've then got your right side and your left side. You've got work to be carried out and present dental status. So this is your baseline. So the outside edge is your treatment plan. Anything that needs to be done or that isn't sound, that we need to keep an eye on or anything like that. Then you've got your baseline. Anything that is present, sound, unrestored, anything that's there. Okay. And then you've got your teeth. So you've got 1 to 8. So you've got your incisors, you've got your lateral incisors, you've got your canines, your first premolars, your second premolars, your first molar, your second molar, and your third molar. The chart is going to be exactly the same for the mixed dentition. It's just different how we chart it to show what's there, to show what's present, and to show that it's a child dentition. Okay, so they'll start charting on the upper right quadrant. They're going to read at the pace of a dentist. You might miss 1 or 2 notations. Make a little note on the sheet and then ask the coach at the end if you need them, to repeat any of the notations. So let's go through it then. So if a tooth is unerupted, this will be charting on the baseline. And you are just going to chart a U and an E. If the tooth is partially erupted, so not all the way through, you're going to do a P, excuse my handwriting, you're going to do a P, E to show this is partially erupted. Now, the reason I've gone on to the next line is because it would usually be a wisdom tooth that is either unerupted or partially erupted. With a child, obviously, it might be sometimes the laterals don't come through or, so on and so on. Okay, if you need to chart a fissure sealant, you're just going to write F, S. If the patient needed to come back for a fissure sealant, you would do it on the treatment line. So say if they said that the upper right second molar needs a fissure sealant, you're just going to chart this on the treatment line. Okay. To chart a restoration, you are going to, so say if the upper right second premolar has a distal occlusal restoration, you're going to draw your distal occlusal and then you're going to colour it in. Obviously, you're doing this on paper with either a pen or a pencil. You're not going to be doing this on the computer, but I'm just showing you for the recording. So that's your restoration. What if it had a cavity? So say the first premolar has a cavity. This is work that needs to be carried out. So this is going to go as an empty circle shape, an empty shape, to show that that tooth has got a cavity that needs treatment. Then when they come back and have more treatment done, you would then colour in that line. And when they come back in 6 months for their next checkup, it would then go onto the baseline. You've got the different surfaces of the teeth. So um, we've got the buccal, which is the outside edge for the posterior teeth. The anterior teeth, it's the labial surface. You've then got the palatal surface on the upper teeth. On the lower teeth, it's the lingual surface. The buccal and the labial is the same for the lower. Then for the surface that is on the inside of the tongue on the lower arch, that's your lingual surface. Then you've got your occlusal for your posterior teeth and your incisal edge for your anterior teeth. So you need to make sure that you're confident with your surfaces before you attend the simulation, so you know the difference. So they might also say that the tooth has drifted. They'll say if it's drifted towards the mesial or the distal. So say if the 4 has drifted towards the mesial, it will be an arrow that is pointing towards the mesial. So this is your midline down the centrals. So the mesial is towards this line. If it's distal, it's away from the line. So if it was the 4 on the left, this would be mesial pointing towards the middle. Does that make sense? Hopefully. Then they might say that the tooth is rotated. If the tooth is rotated, you are simply just going to do a little arrow curling towards the surface that is rotated towards. So if the upper left second premolar has rotated mesially, you're going to do your little rotated arrow. Then they may also say that the teeth are either outstanding or instanding. This just means that, say, if the upper canines are buccally placed, so they're not in line, they are erupting towards the buccal, this is outstanding because they're on the outer edge. So you would just simply draw an arrow towards the buccal. Sorry, the labial in this case, because it's the anteriors. So you just draw a little arrow, that is a straight line, by the way, towards the buccal or the labial, depending on which tooth it is. If the tooth is instanding, it would go towards the numbers in the middle, meaning you just draw an arrow towards the middle. And this is instanding. So instanding, outstanding, drifted, and rotated. I would write these down. Whatever helps you remember these. It's quite a lot to take in. Then we've got missing, recently extracted, or extracted in this course of treatment. So if the tooth is missing, you are just going to draw a horizontal line across the tooth. So say the upper left 1 and 2 are missing, so we're going to draw a straight line. Now, if the tooth is missing, but the space has closed, you then need to add arrows. So if it's missing and the space is closed, you're going to draw little arrows. So that means the gap's closed, the teeth have kind of drifted, and there's no space there where the tooth used to be. Sometimes this can happen in children if they've had their premolars taken out, they've had orthodontic treatment, and then the space is closed, or sometimes the space can naturally close on its own over time. If the tooth is missing, but there's a denture there, so it's an artificial tooth, you would draw your horizontal line to show that it's missing, and then you would do a big A over the top to show that this is an artificial tooth. That is a straight line again. It's quite hard to do it with a mouse, so please excuse my terrible drawing. But yeah, that is to show the tooth's missing and it's an artificial tooth. On your simulation, if they say it's an artificial tooth and you just chart it as missing, that's also a pass. So you can do it either way, whichever you prefer. So let's just go over the restorations again. So the upper left 6 has an occlusal filling. However, this occlusal filling is leaking and it needs replacing, or it's stained, it's chipped. It needs replacing. So if it needs replacing, you're drawing it on the baseline to show, yeah, it's there, but then you're also going to show that it needs replacing And we do that by drawing it on the treatment line and then drawing a circle around this to show that this needs replacing. Okay, so we'll go back to the extractions. So these teeth are missing. This is a denture. This is closed. The 7 is just simply missing. So that is just a straight line across like this. But what if the tooth has been extracted in this course of treatment? If the tooth has been extracted in this course of treatment, we're going to draw a cross. That is terrible. You're just going to draw a straight line, which will be easier to do with a pen, obviously. And it's just going to be a straight cross. I will try that again. For some reason, it's turning it into an arrow. Like so. If the tooth needs to be extracted, so say the lower left third molar needs to be extracted, this is a lower wisdom tooth, you would just draw a line like that. So just one diagonal line across. Then when they come back for the treatment, to show that it's recently been extracted, it turns to a cross. Okay, a lot to take in, but you know, as long as you revise and you practice and use your practice documents and just keep practicing the manual charting, you will remember the notations. It's just quite hard to take it all in on one session, so make sure that you revise for your session. Okay, on your simulation, you may also get that the tooth is retained roots. This means that the tooth might have been extracted, but the root was embedded and wasn't able to remove it, or the tooth's fractured over time. The little roots can be left in if they're not infected. If that's the case, then you're just going to draw little crosses for each root. A lower molar has got 2 roots, so you do 2 little crosses. And if it was an upper 7, they'd have 3 roots, so you do 3 little crosses. Premolars have got 1 root on the lower and 2 roots on the upper, and your anterior teeth, 3 to 3, have all got 1 root. So you just draw a little root like so to show that's 1 retained root. Okay, so that's your retained roots. A lot of people write that must be something that's on one of the computer systems. Please don't write that is a fail. You need to make sure you write a little cross when it's on paper. Okay, let's chart our prosthetics. Okay, so we've done a denture. How do we chart a crown? For a crown, you are going to write, so if it's a crown that's present and sound and doesn't need any treatment, you're going to just write C R on the tooth that's crowned. If it's a porcelain bonded crown or a gold crown, you are going to write the letters. So porcelain bonded crown, again, excuse my writing, or full gold crown. A lot of these notations are just the letters, so it's just remembering the letters and which ones they are. Porcelain veneer, we've got P, V. I'm going to make that V a little bit better just so I don't confuse you all. PV. Implant is just imp. You're just going to write in big letters imp, like so. That's an implant. A bridge, you've obviously got a missing tooth. So your pontic is the false artificial tooth of the bridge. So you're going to chart the tooth as missing. So say we've got a bridge 3 to 5, 4 is the pontic. You're going to first put the 4 as missing, and then you're going to put bridge, pontic over the top. Then your bridge abutment is going to be the crowns of the bridge. Should go like so. Obviously, a bridge unit might have more teeth, less teeth, and you're just going to chart whatever they read out on that simulation. And then we've got an inlay. To chart an inlay, you're going to listen to the surfaces of the tooth that the inlay is on, because it's a porcelain filling basically, or a gold filling, isn't it? So we're going to chart it on the restorations. So say if the lower right 6 is an MOD inlay, you're going to draw the surfaces across like this. You're not going to colour in the full thing. And then you're just going to draw little lines like this. And if it's a porcelain inlay, you're going to write PI. If it was a gold inlay, you'd write GI. This is where it gets a bit complicated, because if you are charting a temporary, you would chart it the same, but you would write temp. Or if you're doing the GIC, you would also chart it like this and write GIC. So it's just important that you write, the correct letters next to your chart. So I think that covers most of the notations for an adult. I don't think I've missed. Oh, there's one thing I've missed. A fracture. If the tooth's fractured, this is going to go on the treatment line, and you're going to draw a little hashtag. And the reason it goes on the treatment line is because that tooth is not sound. It may need treatment in the future. So this is going to go on the treatment line, like so. I think, pretty sure that's it. I'll move on to the mixed dentition, and if I think I've forgotten anything, I'll go back over it. But obviously, once you've watched this video, if you've got any questions, or when you come to your practice documents, if there's any notations that I've not covered, please just get in contact with me and we'll go through it together. But that's pretty much all of it. And then we'll move on to the mixed dentition. So the mixed dentition is for a child. So they're going to have some adult, some mix, it's going to be quite chaotic, to be honest, when they're reading that out. So you need to really concentrate. You can write things down, have a pen and paper with you to help, write them down. And then if you're not sure, like, oh, I missed up a F3, I'm just going to write that down, then you can ask at the end. Okay. So they're probably going to have their 8s missing. If they do, they'll say they're unerupted or missing. So you're just going to simply put unerupted. They're probably going to have fissure sealants or, restorations. They might have a PRR. You're just going to write whatever they read out. So they might have fissure sealant. You know how to do this now. They might need a fissure sealant. They might have a PRR, a protective resin. PRI is charted like so. Okay, this is the bit you need to remember for your mixed dentition. If the tooth is a baby tooth and the adult tooth has either not come through yet or it's missing, you are just going to write the letter. So we've got A, B, C, D, E. If you chart it like this, do the E as well. This is showing that you've got A, B, C, D, E present. So this is probably a really young child that have not got their adult teeth yet. If they're a little bit older and they've got mixed, then to show that it's the birth there, you're just going to draw a little box in the corner. Like so. That's it. So this is showing that the 1 and the A are both there. You do the same for the B. C, you get my gist. And this is how you chart mixed dentition. If they're having orthodontic treatment or they need orthodontic treatment, they might, some of the teeth might be outstanding, instanding, drifted, rotated. So obviously these arrows are towards the outer edge. So all these 4 arrows mean that the teeth are outstanding. If they're instanding, they're going towards the number. So these are instanding. This is your midline. So then if they're drifted, apologies again, this is your midline. If they're drifted, either mesially or distally, so mesially it would be towards the midline, distally away, rotated is your curly arrow. So these are the notations you're going to get on mixed. You may also get restorations. This means the filling is present, so this is an occlusal restoration. Really revise your surfaces as well, because I've seen it so many times where people get labial or lingual mixed up. They chart lingual instead of buccal. They chart palatal instead of labial. You know, make sure you are really aware of your surfaces, and you know, if that's the one mistake you make, you'll kick yourself. So just make sure that you revise those. If the filling needs to be replaced, you're drawing it on birth lines, and you're drawing a circle around to show that this one needs replacing. If the tooth is unrestored but it has a new carious cavity, then you're drawing it on the treatment line. So I hope that makes sense. If you're a bit confused, or you know, this wasn't a very helpful video and you want me to go over it again, please let me know. But that is basically it, and it's completely different to the computer. So you really do need to make sure that you revise this. You can download some practice charts from the Learning Hub on Tile 5. And I can also email you some resources, some booklets, some charting booklets to read and to learn from. Thank you very much for listening, and good luck on your simulation.